I'm Melissa Dees, and this is my speech on World Health. Imagine that you are the parent of an ill child. The nearest medical clinic is 20 miles away and you don't have any transportation. Without treatment, your child will die, but medical care is not easy to come by, and neither is food or clean water. It seems crazy, right? Something that might have happened 100 years ago, not in 2015. Well, surprisingly, this is how many people live in the world today. According to UNICEF, 17,000 children die globally every day, and most of these deaths are from completely preventable or treatable causes. In fact, nearly half of all deaths in children under 5 are due to malnutrition. And alarmingly, the World Health Organization statistics show that 800 women die every day due to complications in pregnancy and childbirth. As a parent and as a citizen of the world, I find these statistics alarming. In industrialized countries like the United States, we tend to take for granted things like clean water, food availability, transportation, and simple medicines like antidiarrheal medicines and antibiotics. In areas of the world like sub-Saharan Africa, these are non-existent, and there are 800 million people living in this area of the world. And according to UN predictions, there will be 1.5 billion people living there by 2050. So, it's a lot of people. We have the opportunity right now to help these children. We just need to have the desire. Luckily, great organizations exist that are paving the way for a better world for these people. Worldwide, 17,000 children die every day. To put that in perspective, according to their website, Ball State University enrolls about 21,000 students each year, and 17,800 of them attend school on campus. That is like losing 96% of the students on campus in one single day. The leading causes of death in children under 5 are diarrhea, malaria, preterm birth complications, and malnutrition, per the UNICEF 2014 Child Mortality Report. All of these are preventable or treatable. There are great people working with great organizations to help correct this tragedy. UNICEF, United Nations, the World Health Organization, all of these groups are working with the governments and citizens in developing countries to reach those children in need. They have set the Millennium Development Goal 5, calling to lower the under 5 mortality rate by 2/3 from the years 1990 to 2015. They have already achieved a reduction in deaths of 49% through their efforts. They are reducing deaths in many ways, including education, intervention, and support. One way that UNICEF is working to target these areas is through the creation of health extension workers. UNICEF works in conjunction with the governments in affected areas to train and certify health workers. Upon completion of training, these workers are set up with the posts and supplies and provide care and support to people in remote villages and rural areas that do not have access to hospitals or clinics. The health extension workers give immunizations and vaccines, provide treatment for diarrhea, malaria, pneumonia, and malnutrition, and provide support for new mothers and pregnant women. Not only that, but the health extension workers also go door to door, providing support and education to the villagers who might not be able to make it to their post. Ethiopia is an example of a success story for these programs. Ethiopia has met the Millennium Development Goal 5 as of 2013, 3 years early, due in large support to the 38,000 health extension workers working in Ethiopia, a country of approximately 90 million people. UNICEF is also a key member of the Partnership for Maternal, Newborn, and Child Health and works with the United Nations and the World Health Organization at the global level to make pregnancy and delivery safer and healthier for both mother and child. In developing countries, more than 50% of women deliver their babies without the help of doctors or nurses, and 99% of all maternal and newborn mortality occur in these countries. UNFPA, the UN organization working to promote better maternal health, helps to train midwives, provides essential medications, and provides women with family planning services. They strive to educate and empower women to take control of their reproductive rights by providing contraceptives, AIDS and STD testing, and by providing access to clean obstetric facilities before, during, and after childbirth. Sanitation is absolutely necessary for human health. However, according to the World Health Organization, 2.4 billion people in the world do not have access to toilets or basic sanitation facilities. This contributes to a major killer in developing countries, diarrhea. Clean water, sanitation, and basic hygiene could prevent many of these deaths. The World Health Organization and UNICEF are working together to end diarrheal deaths in children under 5 by the year 2025 by promoting WASH programs. WASH stands for Water, Sanitation, and Hygiene. The pillars of the WASH program are to provide clean water, sanitation services, and to teach people about hygiene, good hygiene behavior. Not only do they work to develop areas that don't have access to sanitation and clean water, but they also aid during humanitarian crises, when people's lives have been affected by natural causes or by war, and they have lost access to their clean water and sanitation. Thanks to their efforts, 91% of the world population now has access to improved drinking water. UNICEF is working to bring healthcare to those citizens who typically wouldn't have access to it. By providing care, education, and support to the world, they are helping to prevent unnecessary deaths for many. UNICEF is also working with the United Nations and the World Health Organization to provide care and services to pregnant women to help reduce the maternal mortality and newborn death rates around the world. There are several great organizations that are tirelessly working to fix some of the problems that are facing the children of the world. The United Nations, World Health Organization, and UNICEF are just 3 of them. Most of the issues that are costing the lives of those 17,000 children a day are completely preventable. Think about it. Children are starving while we throw food away. Families don't have access to clean water while we take showers daily, wash our dishes, run our washing machines, and don't even think twice about the waste of clean water going down the drain. Pregnant women and children don't have access to life-saving medicine or doctors while we rush to the doctor for every cough and ache. We take for granted the luxuries of our daily lives while 17,000 children die daily. I am thankful for these organizations and the individuals who work and donate to them, and I am thankful to live in a world where people care enough to incite change for the better.